Well, Sue, I think we're going to go ahead and get started. Sound good?
Sounds great.
Awesome. I am Dr. Jessica Dalton. I am a general practice small animal veterinarian. I'm also the University Partnership Manager at VetRec. And I am joined with Sue. Sue is one of our amazing project account managers, and she's amazing. So I'm so glad that she's joining us today. We have a really great day to talk about our dental charts, and I'm hoping that you guys will find it useful for incorporating into your practice. I know as a small animal veterinarian, dentals is a large part of my practice. So something that's very important that it works on a daily basis. So I'm going to go ahead and jump right in, and I'm going to start sharing my screen with you all. And there we go. All right. So now we have our VetRec platform. I have already started a patient for us today. His name is Biscuit. And Biscuit is a fake patient, but he is coming to us basically from a referring vet or a vet that is shared. Maybe he moves between a couple of vets. So we have some records from his other veterinarians that I want to make sure that I summarize before he has his dental procedure with us today. So I've gone ahead and put those records into Record Recap, and it's given me this nice summary of what's been going on with him, when and what happened during his last physicals, any prior issues. So it looks like we've been dealing with some periodontal disease. We also have some prior vaccines, prior medications that are going to all be listed. And if I ever look at something and I go, hey, that looks a little bit odd, where is it pulling from that from the medical record? I can actually click on it here and it's going to pull up a picture of that PDF that I put in of his medical records on the page that's found. So I can actually double check the information that's being presented in this summary. So I say, okay, well, Biscuit looks good on his history. I've seen Biscuit before, so let's go ahead and do his pre-anesthesia note. Okay, so this is usually going to be a note that you're either making yourself while you're talking out his anesthesia plan, or it could also be a note that you're making while you're talking to the team, while you're rounding on your patient and you're going over what the plan for Biscuit is today. So it could include things like the technician going through their anesthetic checks. You can have kind of a checklist for that. It can have your physical exam and your exam that you're doing prior to anesthesia. It can have anesthetic risks, your pre-meds, what induction's going to look like, what maintenance is going to look like, monitoring, all of that good stuff that you are talking through with your team anyway, or that your team is talking through as they set this dental up for you, can all be recorded and easily accessed. So we have Biscuit. He's good to go. He's been pre-medded. We induced him. The technician has done his scaling and his cleaning, and we've taken full mouth radiographs. And now it's time for me to do my medical note. So what I'm going to do is hit New Note, and I will hit Add New Audio. I'm going to hit Start Recording. And then I'm going to just go through my dental findings. So I'm going to look at his teeth and I am saying tooth 108. So this is going to be a carnasal. I'm finding a significant furcation exposure, class 3. We're probing right through the furcation. Radiographs show a large amount of lucency and significant alveolar bone loss. We have significant mobility of 3. We're going to recommend extraction of that tooth. Maybe looking at tooth 204. So we're talking about a canine here. On exam, there's the slab fracture with pulp exposure. The fracture line runs mesiodistally, and the pulp cavity is clearly exposed. So we can see periapical changes on the radiographs. Owner was actually aware of this one being a possible extraction, and I do agree that we need to extract it today. Then we're going to say, hey, all the other teeth look like we have pretty generalized calculus on all teeth, pretty generalized gingivitis, but we are probing depths within normal of 1 to 3 millimeters, and all other teeth look okay on radiographs. So we're going to go ahead and do our extractions. So for 108, we sectioned into 2 roots using the high-speed handpiece and water cooling. We did periostal elevation and luxation of each root. Both roots were extracted intact, and the alveolar bone checked and smoothed. No sharp edges. The socket was lavaged with the dilute chlorhexidine, and we closed primarily with simple interrupted sutures for monocryl. For tooth 204, we elevated and extracted using luxator and elevators. Took approximately 8 minutes. It was a fairly cooperative tooth. The socket was checked, no remaining root structures, sutured with 4-aught monocryl. We also did follow-up radiographs to make sure that we weren't missing anything there, and the follow-up radiographs post-op looked good. He went into recovery, which was uneventful. He was extubated by the technician. His post-op pain was appropriate at 1 out of 4, and we did give him a dose of meloxicam at 0.1 mg per kg post-operatively. For his discharge instructions, we want to do soft food for the next 2 weeks, no hard chews or bones. We're going to go ahead and send home with some meloxicam just for the next 3 days, and we're going to recheck those sutures in 2 weeks. Everything else is looking normal, so we'll go ahead and stop our dictation here. So if you can see, I have a template up here, and it's actually set to dermatology template. So if I generated a note right now, that is what the template it's going to pull from, which would be incorrect. If that does happen, that's okay, because you can actually go in and regenerate the note with whatever template you actually want to use. But since I caught it, we're going to generate it with an appropriate dental one. Biscuit's a dog, so I want the canine dental template, and I'm going to hit generate note. So as this is processing, one of the most common questions that I get asked is, how do I talk to VetRec? How do I make the notes look how I want them to look, basically? And I'll tell you that I talk to VetRec and I use VetRec basically during my normal conversations. I don't change a lot of the conversations that I'm having with clients or with my technicians to fit VetRec. The only changes I'll make is that if it's like a multi-pet family, I will say the name of the dog or the cat that I'm talking about, so that VetRec knows which patient to assign those things to. My physical exam, I'm going to talk through more portions of it. Especially if there's anything abnormal that I want noted, we should be talking through our physical exams anyway. So talking through those with the owner, going over those results just naturally is going to produce a note for surgery, for anesthesia, for things like that. When you're talking to your anesthesia technician, all of those thoughts are going to be recorded. When you're doing an actual procedure, a lot of that is going to be captured in the template itself. But if you make changes, like maybe you change your mind or you use a different type of suture, just make a note of it. Say, hey, I'm grabbing, 2-aught instead of the 1-aught, and it will make those changes for you. So in general, just talk normally. Here we have our Biscuit dental. So it's going to pull up this really beautiful note. And you can see that we have the 2 teeth that I said were abnormal and that we actually extracted are X'd out. And we have our little legend here telling us what that means. And then we have calculus because I said generalized calculus on all the other teeth. And then if we actually click on that 2, so that was the 204, it talks about what I said about what was wrong with this tooth. And then you can even go in and make additional, so maybe it was mobile. I didn't say anything about mobility, but maybe it was mobile, and you can set that at a 2, and then save it. And then that will be saved for your medical record. If you scroll down, you're going to see a more complete list here that's going to go over all of the teeth, and as well as the plan, the in-hospital treatments, the medications, home care, and follow-up. This portion can be set how you want, okay? So this, like all of VetRec, is a template, and the templates can be customized, okay? And you don't have to start from scratch, and I'll show you that in a minute. But you don't have to start from scratch. We can customize it. This is just a starting point for how you want your note to look. So just to recap, we have his previous records that we reviewed prior to anesthesia. We have his previous soap note right here that we did prior to anesthesia that had his pre-meds on it and all of that good information. And then we also have his canine dental that we did. If I needed to add information to this canine dental, very easy to do. All I have to do is click Add to Visit, and I can choose to add more information on this canine dental. Maybe I got distracted and I didn't say something about, 103 and I wanted to add that. All I have to do is hit add to canine dental, start recording, and then process that. So we'll say significant gingivitis at 103, and we also had some gingival recession. And then I'll hit pause. It's going to generate that into our canine dental note. So it's adding that to the note we've already made. Now, a big part of dentals is discharges, right? So we want to also make a discharge to go home with Biscuit. So we'll go over to the discharge. So it's thinking right now because it's already drawing from information from both the canine dental and the anesthesia soap note and the records recap if we wanted to draw from all that information. So once this is done generating, we will have a nice discharge to send home with the owner. So how do we, oh, it already done it. So how do we ask for help? So say this was taking forever to generate or something was going on that we didn't like, and we wanted help with that. We can actually go down here to the chat box, go to messages, chat with us, and here you can actually see who's on. So right now we have Paula, and we have Carlos, and then we actually have our co-founder who is on the chat right now, David D. Matthew. And basically you can chat into them and say, hey, this is what's going on, and we will return your message basically within 15 minutes. So that's a really nice way to get the support that you need if something's not doing what you would expect it to do. So we have our canine dental, we have the anesthesia soap, we're going to go to discharge. Here we get to pick and choose which one we want included. So say we wanted the history in there. I don't, because that's not going to be relevant to his dental today. But I do want included the soap note that we did earlier. I do want the note we just made, and then I want the addendum that I made of the gingivitis. So we're going to hit generate discharge, and that's going to go ahead and make us a discharge. And then from there, I will show you how to email that to the owner. But I do want to go over to the side here. If you don't know, you can actually make this side bigger. And I like to make it bigger because I like to see the words. So if you just go up to this little arrow, hit bigger, you can actually go down to templates. And this is where I was talking about you don't have to start from scratch, okay? If you don't like the output that the dental is giving you, you prefer your notes to look differently, that's okay. We can do that. So go down to the pre-built, go to canine dental. If you click these little 3 buttons over here, you're going to have some options. So you can duplicate it, you can share it. So sharing it means that we're going to share the template with another user. So maybe all the doctors in the practice are going to be using this, so you share it with all the doctors in the practice. You can add it to your favorites. So maybe you do a lot of dentals and you want this one to be one of the things that pop up immediately, or add to favorites on the phone. So you're using your phone device and you want it to pop up. But for this, I want to duplicate it. And then I know it's a duplicate because it's going to say copy. Okay, so if it says copy, then I know, hey, I am able to change this up and label this how I want. So I'm going to go canine dental, and then I'm going to go Dr. Dalton, because that keeps it clean of who this note belongs to. And I'm going to hit save. And now I can look and see all the different parts. So this is the actual canine dental chart. So that's going to give us kind of the picture that we're looking for with the mouth. We have our pre-procedure assessment. We have anesthesia, and you can see all of the different things under anesthesia. So maybe just, for the sake of this example, we're going to add a new entry. And I'm going to do, I want one that is only blood pressure. I really want blood pressure monitored throughout. So I'm going to say blood pressure. I'm going to say list and edit. And then I'm going to give a clear instruction, and I can improve that instruction with AI, but I'm just going to say, what is the pre-op, or I'm going to say, let's say list the pre-op and post-operation blood pressure. So list the pre-operation and the post-operation blood pressure, and we're going to hit close, and there it is. And then we're going to save it. So now, every time that I make a note, we are going to have that pop up. And so very customizable. I'm going to go into templates more in our next webinar. So if you're interested in how to really personalize these, please join us for that. But also happy to answer questions about it. So then we're going to start it, because I want this to always pop up, and we'll move out of there. And now you can see that that star has moved it to the top of my page. So I have that starred, and I also have my anesthesia discharge template starred. So we're going to go back to our visit, and we're going to go to our discharge. And it did discharge, so it did make it. That's okay. So we have our discharge here. We can send this into an email. So if I hit send to an email, so maybe I want to send this to the owner, or I want to send it to the referring vet. That's also an option. But maybe I want to send this to the owner, and then I want to attach the anesthesia soap note as well. I can do that. If I click attachments, it will give me options to attach. Or I can send it as is. All I have to do is put in the send to and send it on its way. I can also make a note that's going to be for the referring vet. So all I have to do is hit new discharge. And we will select a template. So we're going to do referring vet, view all templates. I have it under our DVM, letter, and generate. So now it's going to generate me a letter specifically for the referring vet that I will be able to, again, just email right to the referring vet. So now everything's pretty much ready for Biscuit, right? He's recovered. All of his notes are basically done. I just have to check them and put them into the medical record system. I can make a phone call to the owner right here on the platform. So basically, I'm going to go to this little phone call in the corner, hit phone, 2 options on how to do that. We can do it through the web. So I can call actually through the web as long as my computer has a microphone, or I can call through a phone, which is usually more likely. Your hospital can set up a hospital number, so that's what the client will see, or you can use the randomized number, but setting the hospital number is usually easiest. That way, if you get no answer, they know what number to call back at. You'll put the number that you're calling from, so your office desk, and you'll put the client's number. You're going to hit start call. It's going to connect you to the owner, and it's going to go through a spiel telling them basically that this call is being recorded. And then as soon as you're done, it's going to generate you a note. Again, this is where you want to have your template set, and you want to say, hey, I want a phone call summary for this one. And then it will generate you a phone call summary, and your communications is all done for the day. And here's the referring vet um, information. Other things that could be important would be going over here to the help and clicking on these different icons. I don't know if you guys had a chance to explore these yet, but we do have guided demos available now for a lot of our different callings. So maybe you want to see that phone calling that I did again, or see the discharge or the records recap. We also have a help center that if you type in whatever you're looking for, so maybe I want a easyvet integration. So I want to configure your easyvet export. Yep. And it's going to bring up how to do that and articles and talk you through it and installing, the Chrome extension. So very handy little section that we have under the Help Center. Sue, what are we looking like for our questions?
It's not looking like we have any questions yet. So if anyone has any questions for Dr. Dalton, please go ahead and put them in the Q&A down at the bottom, and we'll be happy to cover those.
Yeah. So looking at the note, um, if you ever wanted to go to the transcript, you can do that as well. You can re-listen to portions of the transcript, or you can simply read what's been going on. So you can see here's the note that I did, that I just did, and then I have the extractions and the recording of talking through each of those that I just made, and then the addendum. So very handy when you need to go back and say, hey, what did I say about this tooth? And you can relook at it if you need to compare it to notes or to just what you thought you had said about that tooth during that time or that surgery during that time. So very handy. I think if there is no questions, then we will probably let you guys go a little bit early because I don't want to take up too much of your time. I know you guys are all busy professionals, but if you do have follow-up questions, please send us an email. You can also just jump in the chat box in that right-hand corner and ask us any questions that you have, or if you have other ideas that you'd like us to cover for webinars, happy to do that as well. But yes, thank you for joining us today, and we will see you next time. Bye.
Thank you, everyone. Bye-bye.